Chairman Tester, thank you. Senator Tester and I serve on 5 of 5 committees together, and we share that joy or burden almost every day. And Mr. Chairman, it's been a pleasure to work with you on a number of pieces of legislation, including the SAVE Act, and I thank President Biden for signing it into law today. I can't imagine there's another member of the United States Senate that I have teamed up with that has resulted in more legislation being passed and more legislation being signed into law. So thank you for your efforts to put up with me on 5 committees and to work together on legislation. And this issue for me arose when I was visiting the Topeka Comrie O'Neill VA Medical Center and their vaccine site now perhaps 3 weeks ago. And one of the items that was brought to me by the director as well as by veterans is a reluctance on the part of veterans to take the vaccine, to get the vaccine in the absence of their spouse or caregiver being able to get it as well. And just common sense indicates that's a solution, a problem waiting for a solution, and I'm pleased to see that that's taking place. And I thank the folks at Comrie O'Neill for hosting me to see and talk to veterans about the vaccine, which led to my interest in this topic. I'm pleased also to be here this afternoon to discuss one of Senator Tester and I's top priorities, this committee's top priority, on veterans' mental health care, as well as a comprehensive veteran suicide prevention legislation that we worked on last year, the Commander Hannon Act, which became law last year. I want to thank all of our witnesses for being here today, and I extend a special welcome to Jim Moran for joining us. He's with the American Warriors Partnership. COVID-19 pandemic has exposed substantial gaps in America's mental health care system, both within the VA and throughout communities across the nation. Many Americans have experienced devastation due to the loss of family members or friends, while others have experienced joblessness and financial uncertainty. While it's important we continue to prioritize vaccinations for all American adults as soon as possible, it is also critical that we do not forget about the mental health toll that this pandemic has taken on Americans and especially on our veterans. We know this pandemic has led to a rise in anxiety, depression, suicides, and overdose deaths. In fact, a study recently published by JAMA Psychiatry illustrated that the emergency department visit rates for suicide attempts and overdoses were much higher from mid-March through October 2020 compared to the same period of time in 2019. For many veterans who already live with mental health conditions or an addiction, the added social isolation and the fear due to this pandemic has heightened these conditions. A survey released last December by the Wounded Warrior Project found that 30% of the 30,000 veterans polled reported recent suicidal ideation, and roughly 60% reported symptoms of moderate to severe depression. This is another wake-up call for all of us. Thankfully, Congress worked in a bipartisan manner last year to pass the Hannon Act. Now it's up to the VA with alacrity to implement this comprehensive suicide prevention law consistent with congressional intent. Getting results for veterans is what matters, and I'm glad our oversight today is oriented toward that goal. Taking into account the high rate of veteran suicide is now more important than ever for the VA to execute the life-saving provisions contained in the John Scott Hannon Act. We know that connectedness to one another, to other veterans, to family, to community is an important protective factor for suicide. We also know that 2/3 of veterans who die by suicide have no meaningful contact, interaction with the VA prior to their deaths. It is imperative that the VA move quickly to implement the Staff Sergeant Parker Gordon Fox Suicide Prevention Grant Program. This program will extend VA's reach to vulnerable veterans not under the department's care and enable us to bolster organizations already serving veterans in communities across America. Additionally, I was encouraged by the recent update my staff received on a provision in the Hannon Act regarding the VA's implementation of safety planning in the emergency department, SPED. SPED is an evidence-based intervention program that is shown to decrease suicide by 45% in the 6-month period following intervention. While SPED was originally rolled out in October of 2018, only about 28% of VA facilities used this intervention. So in 2018, 28% of the facilities used this intervention. In January 2020, the VA had only marginally improved to 33% of facilities using this evidence-based intervention. Now, Because of this committee's oversight, the actions by the Department of Veterans Affairs, over 82% of all VA facilities have adopted it, and I applaud the department for this dramatic improvement. I look forward to hearing from our witnesses today. Before I close, though, I would indicate to any veteran that is in a crisis mode, anyone who is listening now that has an ideation about suicide or needs mental health counseling, please call 1-800-273-8255 and press 1. Again, it's 800-273-TALK, and then press 1. And I yield back, Mr. Chairman.